Oh, wait. Okay, go.
Good afternoon. My name is Jean Jordan, and I am the nurse care manager for Chittenden County, and also I go up north and partially south. And today is March 3rd, and we're talking about the subject of depression. We just observed on YouTube a video named What People with Depression Want You to Know. It's very interesting video, and I think you would enjoy it if you would want to turn into that video to see this before you watch this tape too. I'm going to start first talking about exactly what depression is. And depression is a mood disorder. It's a persistent feeling of sadness and loss of interest. The affects oftentimes how you feel, think, behave, and it can lead to a variety of physical and emotional problems. You may have trouble doing normal day-to-day activities, and depression may make you feel that your life isn't worth living. It's more than just a bout of the blue. Depression isn't a weakness. It is something that you cannot simply snap out of. Depression may require long-term treatment, but don't get discouraged. People with depression usually feel better after medication, it's psychological counseling, or both. Sometimes people might only have depression once in their life, but oftentimes it reoccurs. And during these episodes, symptoms occur most of the day, nearly every day, and it may include, number one, feeling of sadness, emptiness, or unhappiness. Number two, angry outburst, irritability, or frustrations, even over small matters. Number three, loss of interest in pleasure, or even in normal activities such as sex. Number four, sleep disturbances, including insomnia or sleeping too much. And one of the classic signs of depression is waking up early in the morning and not being able to get back to sleep. Tiredness and lack of energy, so that even a small task takes a lot of effort. Changes in appetite, often reduced appetite and weight loss, or it could be increased cravings for food and weight gain in some people. And for example, chocolate is an excellent craving because it does provide the serotonin and it helps you to feel better. Anxiety, agitation, or restlessness, maybe excessively worrying about something, pacing, hand-wringing, or an ability to sit still, slowed thinking, body movements, slow speaking, feelings of worthlessness or guilt, fixating on past failures, or blaming yourselves for things that you are not responsible for. Trouble thinking, concentrating, making decisions, and remembering things. And frequent thoughts of death, suicidal thoughts, suicide attempts, or suicide. And lastly, unexplained physical problems such as back pains or headaches. In the various types of depression, it can affect everybody differently. And to clarify the type of the depression, the doctor may add information to your depression diagnosis called a specifier. Specifiers include having depression with specific features such as anxious distress, mixed feelings, melancholic features, atypical features, for example, the need for sleep, the sensitivity for rejection, and a heavy feeling in your arms or legs. Psychotic features, catatonia, peri or postpartum depression, and seasonal depression. And I think we all might have had experienced one of these to a small degree sometime throughout our life. But when it becomes more debilitating it can become and affecting your everyday living. It can become severe depression that requires treatment. Depression can occur in children, and younger children. It may include sadness, irritability, clinginess, worry, aches and pains, refusing to go to school, or being underweight. In teens, it can include sadness, irritability, feeling negative and worthless, poor performance or poor attendance at school, feeling misunderstood, being extremely sensitive, using drugs, eating or sleeping too much, and self-harm, loss of interest in normal activities, and avoidance of social interaction. One of the self-harm areas is cutting, and I have seen this happen with a friend of mine. They cut to take away the pain of the depression, which is more severe than the actual physical cutting of the skin. Depression may occur with other mental health conditions such as anxiety, eating disorder, substance abuse, or attention deficit / hyperactivity disorder. Depression often appears in older adults, but it's not recognized. There is a geriatric psychotic depression, and when it occurs, it seems like that person is not with it, might be having hallucinations, delusions. There is treatment for it, and it does not need to persist. With depressive medications available, and they will come out of it. Memory difficulties or personality changes in the elderly are a sign of depression. Fatigue, sleep problems, lack of appetite, aches, loss of interest in sex, which are not caused by a medical condition or medication, and oftentimes not wanting to go out to socialize or do new things, but just wanting to stay put at home. And especially in older men, they have suicidal thinking or feelings. And if you think of an older gentleman who's been very active in his life and all of a sudden has nothing to do and does not feel he's contributing to society, it's understandable why they sometimes will go through depression. So when do you see a doctor? It's best to see a doctor and make an appointment as soon as you see the first beginnings of the symptom of depression, because untreated it can get worse and it will be much harder to resolve it. If you don't want to seek treatment, talk to a friend, talk to a healthcare professional, talk to a faith leader or someone else you can trust, but do talk to somebody. The other concern is having suicidal thoughts. If that happens, please get help right away. Because in reality, when you're not in depression, you're not going to have these thoughts. And you don't want to go through life and end your life just because you could have had some help through that. Again, reach out to a close friend, somebody of your faith. They do have a suicide hotline, and it's 800-273-TALK. And there would be a counselor there, and they also or make an appointment with your doctor. Depression is a serious disorder that can take a terrible toll on individuals and families. Untreated, it can result in emotional behavior and health problems that affect every area of your life. Complications with depression can be excessive weight or obesity, alcohol or substance abuse, anxiety or panic or disorders or social phobia, family conflicts, work or school problems, social isolation, suicide feelings, self-mutilation, and premature death from other medical conditions. So it's very important to get help for this. So what can you do? Make a list of the symptoms that you are having, and I have in our packet of information a test that they use. It's called the Goldberg Depression Questionnaire, and this is a personal test for you to take, And if you suspect that you are depressed, consult with a mental health professional as soon as possible. The questions that are on this test are, I do things slowly, and then it gives you options to check off, not at all, just a little, somewhat, moderately, quite a lot, very much. Question 2, my future seems hopeless. Question 3, it is hard for me to concentrate on reading. Question 4, the pleasure and joy has gone out of my life. Question 5, I have difficulty making decisions. Question 6, I have lost interest in aspects of life that used to be important to me. Question 7, I feel sad, blue, and unhappy. 8, I'm agitated and keep moving around. 9, I feel fatigue. 10, it takes great effort for me to do simple things. 11, I feel that I'm a guilty person who deserves to be punished. 12, I feel like a failure. 13, I feel lifeless, more dead than alive. 15, I spend time thinking about how I might kill myself. 16, I feel trapped or caught. 17, I feel depressed even when good things happen to me. 18, without trying to diet, I have lost or gained weight. If in this self-exam that you take, if you have 5 of these, I would encourage you checked off that indicate it's concern. I would encourage you to go to a person to talk. If you only have 1 with the suicide, please go. Bring in the information about your medications, vitamins, or other supplements. Key personal information, including any major stressors or changes in your life. And it's nice to have a family member come along or a friend, because they can be your support system and they can also help to remind you and ask questions. Because sometimes it's hard to, when you're so depressed, to be able to put it all together. So the questions they're going to ask your health provider is depression the most likely cause of my symptoms? And what are other possible causes for my symptoms? So diagnostic criteria for depression, as we mentioned, the quiz that we take, they also have criteria with a diagnostic and statistical manual of mental disorder published by the American Psychiatric Association. And this helps them to, if you have 5 or more of the following symptoms over a 2-week period, most of the day or nearly every day, at least one of the symptoms must be either a depressed mood or a loss of interest or pleasure. Again, depressed mood, number 1. Number 2, significantly diminished interest or feeling. Number 3, significant weight loss with not dieting or weight gain. 4, insomnia or increased desire to sleep. 5, restlessness or slow down behavior. 6, fatigue or loss of energy. 7, the feeling of worthlessness or excessive or inappropriate guilt. 8, trouble making decisions or trouble thinking or concentrating. And 9, recurrent thoughts of death or suicide attempt. What are other conditions that can cause depression? Adjustive disorder. This is type of a stress-related reaction to stress that happens in your life, and that causes depression. Bipolar disorder. This mood is characterized by mood swings that range from highs to lows. It's sometimes difficult to distinguish between bipolar disorder and depression, but they are different, and they are treated differently with medication. Cyclothymic disorder. It involves highs and lows, but it's not as strong as the bipolar disorder. Persistent depressive disorder, sometimes called dysthymia. This is not as severe as the chronic form of depression. It's usually not disabling, but it does affect your functioning in your normal life. Premenstrual dysphoric disorder. This will occur around the time of menstruation, and it affects you for the time frame before or after. and attention deficit hypersensitivity disorder, especially children, can experience sadness or a feeling of loss. It's good to understand the type of depression that you have so you can learn about the specific treatments and medications for that depression. Numerous treatments are available. Number one, psychotherapy and medications. Medications are divided into a select group. First choice is selective serotonin reuptake inhibitors. The serotonin is a chemical in your brain, and that it affects your brain as far as your mood. And the medications that help to provide treatment of depression in this class are Prozac, Paxil, Zoloft, Celexior, and Lexapro. Lexapro is the latest one and the newest one, and generally is being prescribed at this time. Celexior would be following that. Prozac is one of the older ones, and it has a long half-life, so it stays in your bloodstream for a long time, and it can be tranquilizing effect. But each person reacts to the medications differently. The next one are SNRIs, serotonin and norepinephrine reuptake. The examples of these, which are Cymbalta, Effexor, and Prestige. All three of these are relatively new medications. Cymbalta also helps nerve pain, so people who have peripheral neuropathy, it definitely can do both depression and nerve pain. Effexor RL also helps to give increased energy plus treat depression. Prestige is a relatively new one that's just come out in the last 2 years, and again, that might have a little bit of a tranquilizing effect, but each person does react differently. The next classification is norepinephrine and dopamine reuptake inhibitors. This would be more appropriate for, has less side effects, so that of sexual side effects. So if somebody is having a sexual side effect from these previous medications because of the serotonin uptake and reuptake inhibitor, this can be used. Wellbutrin is an example of this. However, if you've had a history of seizures, you cannot take Wellbutrin. Atypical antidepressants. These are antidepressants that were used a number of years ago, and some of you might be familiar with trazodone. In fact, it still is used in a very small dosage to help the elderly at nighttime to go to sleep. Tropinol, Pamelor, and amitriptyline. These usually are not prescribed unless if all the others don't work, because they cause sedation. Then which one? MAOI inhibitors, monoamine oxidase inhibitors. That is only used if for some reason the other ones are not using it. There can be serious side effects with other medications or food, such as cheese, pickles, and wines. It needs to be closely monitored. Okay, anti-anxiety medications might be used. A lot of these medications, like especially Lexapro and Effexor, are tremendous for anxiety. If they were to use Ativan or Valium or any of these medications, these are addictive and usually not recommended for any long time. It's just for a short term. So finding the right medication is the most important, and seeing what works best for you. Okay. Again, they caution people, especially those who are on anticoagulants, or they caution about using alcohol because it can affect your antidepressants. You'd want to be careful about taking any supplements over the counter, such as St. John's wort or SAMI, with any of these medications. that we just mentioned. However, the over-counter medications can usually be used independently without these medications. But please consult with your doctor first, because you want his best opinion. If you are pregnant or, of course, breastfeeding, there are some medications that cannot be used either. And there are some medications that increase the suicidal risk, and this varies upon the individual. So, for example, if you're taking some Valter and you feel more and more that you are becoming more suicidal, that is likely the medication, and you need to talk to the doctor and get that changed under his supervision. Psychotherapy is known as talk therapy. It's very important for whoever you choose to go to see with psychotherapy that you have a good flow of communication with the person. If you do not connect with that person, be open and honest, because it's not going to help you. If they're talking way above your head, let them know. If you prefer to talk to a lady or a man, let them know. Do not be afraid to speak up. They're not going to feel hurt, and it's you that is important to get the treatment that you need. They do have hospitalization and residential treatment for people who are depressed. Again, that depends upon what is best according to the doctor that's seeing you. Other types of treatments are ECT. ECT has had its ups and downs. It's had its stories and fables. They do use it in geriatric depression at times. It can cause sedation. It can cause memory loss. It can cause physical side effects such as headaches. And before you have ECT, evaluate and study the pros and cons of it. Just research it. The other form of treatment, which is becoming more and more available as it's becoming known, it's not that readily available here up in northern Vermont, but they do have it in the major regional centers down, for example, in Boston, is transcranial magnetic stimulation. Some insurances do not cover this, but some do. And they're finding that it definitely is working. It's not invasive. You just sit in a reclining chair with a treatment coil placed against your scalp, and the magnet therapy helps to resolve the depression. It's 5 treatments each week for up to 6 weeks. And if nothing else works, I would certainly try that, because that is non-invasive. And I would be an advocate for it for anybody in my family if they were having long-term depression. Stick to your treatment plan, learn about depression, pay attention to the warning signs, and get exercise. Exercise helps to increase the dopamine in your brain, and it will help to decrease the severity of your depression. Avoid alcohol and illegal drugs, and get plenty of sleep. The herbal remedies and supplements that we talked about were St. John's wort, SAMI, and the omega-3 fatty acids. All 3 of these have been used over the counter to try to help mild depression. With some of these, again, they cannot be coincide with an antidepressant unless if the doctor approves. And the omega-3 fatty acids, if you're on an anticoagulation, such as Coumadin, you cannot take it without approval of the doctor, because it does affect your bleeding time. Okay, let's see here. This is all written out in the form if you would like to stop at the office and have it too, and we will be telling you the references to this. Other choices of examples of mind-body techniques are acupuncture, yoga, meditation, guided imagery, massage therapy, relaxation techniques, music or art therapy, spirituality, and exercise. Suggestions are made to simplify your life. If you're under a lot of stress, of course it's going to become mind-boggling, and depression is easier to set in. Look at the stress factors in your life and figure out what can be eliminated. What's priority in your life? Some people find it helpful to write in a journal. Some people read self-help books and go onto websites. Some people go to a local helpful organization that deals with support groups in depression. Don't become isolated. Join an activity group or have something happening that you can enjoy and look forward to getting together with family or friends. Eat a healthy diet, be physically active, and get plenty of sleep. Relax and manage your stress, structure your time, and don't make important decisions when you are down. Wait until you feel you are able to handle it better. Again, reach out to family and friends. The last part of this is how to support loved ones with depression. And I'm sure that we all have had people in our family that have gone through depression. The most important thing is to let them know that you are there for them, that you care and that you love them, and be available. If it means a phone call in the middle of the night, that's okay. If it's helped them to get through the crisis that they were going through, they do not want to be feeling alone, and they need to feel that you're there. Be a good listener and speak up. If you notice things are happening that are changing, speak up and let them know, wow, this seems to be a change. What's going on? If you can, say, do you mind if I talk, if they don't feel comfortable in talking to their physician, do you mind if I talk to your doctor about this so that we can get you what you need? Okay. At the end, we have a quiz available. It's a 10-question true or false. And I just wanted to become and personalize this now that we've gone through all the information. Some of you know me, some of you don't, but I am blessed to have 4 beautiful children, and my first child, I had postpartum depression, pre- and postpartum depression, and very severe. Postpartum depression is quite common, but it's the severity that changes, and it can be mostly chemical. I at that time was on a seizure medication and a strong medication for nausea because of my vomiting all the time and the concern about the seizure medication combination. I became very weak, and I just pushed myself to go to work every day. And I was really too weak to be able to do so, and the anxiety level increased so high that I got to a point where I didn't want to go out anymore. And that's called agoraphobia. Agoraphobia can be a challenge. It can be very painful. Anybody that goes through it knows where I'm coming from. I had to go out. I had to go after having my child. I had to go back to work. I had no choice. And I was working for the Visiting Nurse Association in an inner city, in a large city in the high rises, and it required physical activity going up and down the stairwells. And I just had to go and say, Jean, you got to go. You cannot. And so I put a tape on anytime I went out to work. And I just used that tape to get me through the time to get to work. Once I got to work and once I got into the pattern or the flow of work, I was okay. But it was just getting going and having the agoraphobia and getting over it. Eventually it dissipated, but it did take a while. It didn't happen right away. It takes a lot of energy and effort. And during the time of that postpartum depression, I did seek counseling. However, it wasn't a good counselor because we didn't communicate. He was Oriental. I didn't understand half of what he was telling me. This was in the year of 1975 when postpartum depression wasn't really well understood at that time. They tried a variety of medication, if you could imagine, even Haldol, which is completely negative. And it made me worse. And I just eventually, fortunately, was able to get through it. I did go into a hospital for treatment, but that was against my will. It wasn't my desire because I had to leave my brand new baby. And I was out of that hospital within a week. I had signed myself out. And when I got home, I made a determination that I was going to get better. I have a very strong faith. And with my faith and His help, I was able to go through it and be the person that I needed to be for my newborn baby. So I have been there. I know how hard it is. And I know what it means to wake up in the morning and not be able to sleep, knowing that you've got to get to work. How am I going to get to work in only 3 hours of sleep? How can I do that? I know what it means to take alcohol and use that as an escape, hoping that it would take away the pain. To just hibernate in your home, to close up and feel, your self-worth is gone. And I ate chocolate and wine and chocolate, and I became a tub. And so it can happen. And having gone through it, it certainly could happen at any time for anybody to go through depression again. But it did make me wise. And it certainly made me know the pain that anybody goes through with depression. I was also at one time, just to share with you, my roommate had just gotten out of Waterbury, and she had severe schizophrenia. And knowing how I was able to deal with depression, I was able to help her, and she had a very hard time with it, and her concerns were becoming more and more psychotic. And with depression, that can happen. But once the depression is healed, the psychosis usually goes away. And she did get better. So I just wanted to share that with you because I chose to do this subject when I was explained that I would be needing to do an in-service, because this is the subject that I know personally that I had pain in my life. And I just want to share it with others and help to understand what depression, there's always a light at the end of the path. It's not going to always be there. There will be hope, and you will come out of it. Thank you. Now, I didn't know if anybody wanted to share anything or any questions or...
Jean, I have a question. Was not so much a question. Earlier in the presentation, you brought up the notion of trivializing when someone tells you that they're feeling depressed. Can you talk a little bit more about some examples of how would I know if I was being trivial with somebody who was depressed? If they told me they were depressed and they started elaborating, what would I do to trivialize that?
I think mainly by saying, Alan, you have nothing to be depressed about.
Oh, okay.
You have a wonderful job. You have a wonderful wife. You're very intelligent. Count your blessings. And not acknowledge that actually depression is real. And even though what I said was true, depression is still real.
So I'm hearing you tell me that it's important to validate the feelings of the person who's feeling depressed.
Yes, definitely.
Let them know that those are real feelings, and even though you may not have them or I may not have them at the moment they're having them, that it's real to them.
Right.
Not to diminish that.
And the fear that you have when you're depressed can get overwhelming. The anxiety. People, when they go out in the community, just might start feeling, I can't go into that store. Or if I go to that place, I'm just going to shake. I don't know what I'm going to say. I'm so inadequate. What am I going to do? I don't want to face that reality of doing and meeting these situations, and you stay home and you hide. And the agoraphobia comes. And then you give in to the agoraphobia.
Mhm.
And it just gets complicated more and more. So the most important thing is, number one, recognize that you are a person that has a lot of value. Each one of us has value. Number two, that your family love you. And number three, that there's help for you also to go and get medical treatment and counseling. A lot of times depression is caused by a chemical imbalance, especially with geriatric depression, postpartum depression, seasonal depression. All of these are affected by chemical imbalances, and the medication helps to just bring that chemical balance under control. They are finding more and more now, and it's research, that not only is it a mood disorder, but it also, one of the questions is, depression is a physical disorder, and it was going to be false. But they are finding now that it has become more of a physical disorder, because there's a part of your brain called the hippocampus that is affected with emotions. And as you get depressed, that area can start to shrink. And so they are finding more and more medications available that are able to help to take care of that. And so it is becoming more defined.
The mind-body relationship is a very complicated connection, and you're right. It changes many things about you when you are feeling depressed or you're swinging in moods and things of that kind. I remember when I was a teenager, I felt, for a period of time, I felt very, very sad and very down and very isolated socially, and I didn't know at the time that the label was depression. In hindsight, I know that's what I was experiencing as an adolescent. And I did like you were mentioning, I turned to drugs and alcohol at that time in my life as a relief, even if it was on a temporary basis. And I hid, I stayed away from people a lot when I was struggling with my feelings. I even one time thought about suicide as a teenager. And one of the things I've come to realize over time, with some more education about depression, is at that time the idea of taking my own life seemed like a reasonable solution at that moment. Like it was going to be okay if I did it. But I realize now that it was just a temporary solution to a long-term problem that needed more correction than just me taking my life. And if I stayed with it long enough with somebody helping me, I probably could find a way out. And I did. Eventually I did. But it was because I didn't make the choice to hurt myself. Mm-hmm. I mean, I thought about it. I even planned a little bit about how I could do it if I really wanted to. So at that time, I was pretty much on the fence there. I was living pretty dangerously at that moment. I didn't talk to my parents. I didn't talk to my sisters. I didn't talk to my friends about it. All of this stuff was just going on inside of me. And I'm hearing you say that that's very common for people who get depressed. If it sits inside and festers.
You withdraw. You don't want to have
Don't
the time
want that.
get up out of bed. You don't want to go face the world.
Yeah.
You feel your whole value system isn't. You feel poor self-esteem, and it's so important to realize that you're not alone. Lots of people have gone through it.
Do you have advice for anyone living with someone who's depressed?
Yes, because people living with somebody also can get depressed from being overwhelmed by the depression.
Yeah.
And I think that that's important for that person to have somebody to go to talk to.
So they need to seek assistance as well.
Yes, and understanding not only of the person they're living with the depression, but how it's affecting them. It's just like with Anon, Alcoholic Anonymous.
Yes,
They have-
and Al-Anon.
Okay.
Yeah.
They have a support group. There should also be a support group for people who are going through, family members that have families
Yeah.
that are depressed. Yes. My mom had non-invasive hydrocephalus, which is a brain disease, and she was disabled from it. And she naturally went through depression because it limited her activities as to what she could do. And again, family support and being there to help her. And she was put on Cymbalta, which did wonderful for her because she also had peripheral neuropathy. And that made a difference in getting her out and doing activities. And as her mind gradually faded, we still kept her busy. She developed the Alzheimer's, but we still had a project for her to do. Her project might have been to read the paper. That was her work for the day. To fold something. Just as long as she continued to feel that her worth was, she was worth her value. It was worth something. And so I think, we all have had family members that have gone through times, and I know myself, I was there. I know what it's like to be in a hospital where the door is locked behind you. I know what it's like to see others who are going through depression at the hospital I was at. There was a young girl, and she didn't feel worthy enough to sit at the table to eat her food. So she was not eating, and eventually when she did eat, she sat on the floor because her feelings of self-worth. It's just, how depression can be destroying, but it doesn't need to be. Because there is treatment for it, and the first step is just saying, okay, I might be depressed, but it's not the end. There's going to be a light at the end of the tunnel. I'm going to go and do something about it.
May I interrupt and ask this, your opinion about this? There are situational types of depression, right? That are not long-term, necessarily long-term.
Right.
They're caused by circumstances that we encounter or that we experience in our life somewhere along the way. Somebody dies, we are in a car accident, we lose something, and for maybe a period of time we might be down and really out, if you will. It would seem to me on that kind of a situation that maybe the first step is to find somebody to talk to. Would you agree with that?
Definitely.
Rather than jumping to a doctor and saying, oh, I need a pill to fix me?
Yes, definitely. If something immediate and extreme is happening in your family, talking to somebody, and even the seasonal depression. That can be very damaging, and your feelings of going out and doing things. You just want to hibernate because you're depressed, and talking to somebody, getting the light therapy for that will make a difference. Postpartum, there's support groups to help people now. Postpartum depression has greatly information about it, and treatment is far better than what it used to be. So definitely support groups.
Okay.
Okay.
Penny, did you have any questions?
No, I didn't. Very good though, thank you.
Thank you.
Jean, we thank you so much for helping out today and offering us such good information. I verbally remind anyone listening to the tape that these videos are available on our website 24 hours a day once they're posted there, and anyone can have access to these videos. They do not have to be an employee of TLC to access these videos. They can be a family member, they can be a friend. It might be an opportunity for you to even have a way to bridge a conversation with somebody that you think might be suffering some pain. So we hope that these tools are going to be used by the staff of TLC and others. And again, thank you so much, Jean, for coming and helping us today to learn about depression.
You're
It was
welcome.
very well done.
And there is a quiz to be taken if you're interested in it. Just let us know.
And also that the quiz will be placed on the website below the video at the TLC Academy that you will go to access this video in the future. And upon completion of the test, you should notify me, Alan Susi, the Director of Nursing at TLC, if you are a staff member of TLC, so that I can give you appropriate credit for observing the video. So again, thank you for being with us
You're
today.
welcome.